A beautiful afternoon to you, and many thanks for joining us on the program Healthy Living. Yes, we always tell you that when you're healthy, you remember how to put on some nice clothes, you remember the party you need to go to and all of that. All right, today on Healthy Living with yours sincerely, Oluije Oikokai, we're talking about something very important, yes, to our life, to our day-to-day living, and that is talking about dental caries, tooth decay, and its implications. And to do that with us is the person of Dr. Usakwe Kelvin. He is a dental surgeon. Now, quickly now, dental caries, as we all know, is has to do with tooth decay. Now, there are some facts that might surprise you about dental caries. It's one of the most common chronic diseases worldwide. Yes, most common chronic diseases worldwide, affecting people of all ages, from toddlers to seniors. Now, when we talk about toddlers, you'll be shocked that as young as a 3-4-year-old child, 5-year-old child complaining about his or her tooth. Now, you need to take that child to see the doctor. All right, so it starts as a tiny hole or the cavity on the tooth, often caused by bacteria that thrive on sugary foods and poor oral hygiene. But sometimes we tend to just overlook these things. We ignore them, not taking the child to go see the dentist. Now, dental caries can lead to severe pains. Yes, you find the child continue talking about, I have pains on my teeth, I have pains on my tooth, mom, my gum is paining me, and all of that. Infections and even tooth loss. Yes, we can actually lose our tooth because of these malfunctions. All right. Now, the good news is it doesn't have to get to that point where you have to start getting panic because you have your doctor to go meet with. All right. So it seems like I'm doing all the talking, but don't worry, our doctor is here to explain all of these for us. And of course, there are different ways we can actually take good care of our teeth. Yes, some persons don't know that it's actually good to, floss your teeth, brush them regularly. Sometimes our doctors will say 3 times a day, 2 times a day, but you know what? Our doctor is here to answer all your questions. Now, do you know that by the age of 34, nearly 90% of adults in the world have experienced dental caries? Now, some persons, they'll be wondering, what is dental caries? It's tooth decay, okay? Now, and it's not just a cosmetic issue. It can also affect your overall health. Yeah, studies have linked poor oral health to serious conditions like heart disease, diabetes, and even issues with the heart. Okay, now so this is definitely something you must and want to pay attention to. Now, the good news is dental caries is preventable. Yes, early detection is key. It's preventable. We just have a few things to do to make sure that we stay healthy and have good tooth hygiene. Now, consistent habits, regular brushing with some, toothpaste, medicated one, the one that our doctors have recommended for us. Now, flossing is always good. Floss daily, and also cutting back on sugary items. We know our children, they love to eat chocolate and all of that. You need to cut down on these sugary foods that can also cause these dental caries. Okay, it goes a long way in preventing decay, and do not also forget your regular dental checkup. All right. Now, where professionals can catch problems early, they can actually detect these issues on time when you go for regular checkup. Now, we also want to explore the issues of dental caries in developing areas and also the risk factors. Now, we need to also know that sometimes we just tend to wake up in the morning, so persons actually forget to brush their teeth. Is wrong. We need to learn how to take good care of our health. Remember, health is wealth. Okay, you need to take good care of yourself, take good care of every part of your system, every part of your body. You need to stay hygienic. You need to stay in focus. You need to be consistent in everything you do. Now, looking forward to dental caries, we also know that dental caries is a breakdown of the tooth and also the hard outlets of the tooth. Now, these bacteria feed on sugary substance. Sometimes when the doctor says brush twice a day, they have their reasons for saying that. You brush in the morning. Sometimes they will also tell you when you want to, you can actually brush after you've taken your meal in the morning, and at night, after your meals at night, you should also brush your teeth, okay? Now, looking at the bacteria that feed on sugars in food we eat, producing acid and erode the enamels and lead to cavities, small holes. When we talk about cavities, yes, we need to see some small holes in our tooth, and it also has to do with leading to pains around our tooth. Infection comes in, we tend to have headache, we tend to have infections and severe cause of pains around our tooth. Now, some persons may like to ask, how does dental caries develop? Dental caries can start by, you know, just a little tooth pain. You can start having tooth pain, and from there you get to have holes around your tooth and all of that. So you need to go for regular checkup. Regular checkup is key. Now, looking at sweets, chewing things that are definitely, that has sugary items, it doesn't cut. You need to cut down on every sugary items that leads to these dental caries that causes tooth decay. Looking at also how to take good care of our teeth. Some toothpastes are, you know, hygienic. Some dentists, they tend to tell you this is what you should take at a particular time to avoid some certain things. So we'll be talking to our doctor right now, Dr. Sakwe Kelvin in the studio. Dr. Sakwe, good afternoon. Okay, so let's dive into questions. So many persons have sent in questions to ask you on dental caries. Now, quickly now, the question is, what causes tooth decay?
All right. Well, basically, we will attribute this to about 4 factors.
Yeah.
All right. We talked about substrate, which is refined sugar. Then there's a host that acts on that substrate. That's the bacteria. Then this happens over a period of time. That's already like 3 factors. I talked about the substrate. I talked about the host, the bacteria that act on the substrate. Then we talked about the host tooth. There are teeth in the mouth that are susceptible to these infections, and that can be due to some, defects on the tooth. All right, so the particular tooth that is involved, and of course, over a period of time. All right, so those are the 4 major factors that, contribute to this tooth decay.
Okay. Now, when you someone hears dental caries, we know it's a big man term, or will I say it's a term that we all don't seem to understand. Now, someone out there might want to know, or you have to bring it down to their level. What is dental caries? All
right, dental caries simply is hole on the tooth.
Okay, tooth
decay. Or tooth decay, yes. Or cavity on the tooth. That's what dental caries simply stands for.
Okay. Now, you said over a long period of time. Would we say like 3 months, a year, 2 years?
Well, okay. Let me break it down this way. Now, for children, sometimes you can see a baby that is just like 2 years old or even a year plus already having holes on the teeth. All right? You can also see an adult who is probably, already have a permanent tooth and around age 20, 25, 30, now start having hole on their teeth. Now, when we're talking about the time duration, it's actually it's not well defined as it well. It has to do with the individual that is involved. All right, so like we said, it's relative. So the time duration that someone will have you will not start seeing cavity or frank tooth decay on the tooth might differ or might be different from another person.
Okay, so what are these symptoms that one need to look out for to say, okay, I need to go see my dentist?
Okay, fine. Well, I will divide it into two. All right. Now, let me talk about the children first.
Okay.
All right. When I'm talking about children, I'm talking about children from the age of around 6 months when they start bringing down tooth. All right, till around 12 years. Okay. By then, they're already erupting the permanent tooth. Okay, because we have what we call the mis-dentition stage. That's when children still have the milk teeth, which is the baby teeth, and the adult teeth. All right. Now, let me talk about those set of persons. Now, I have seen patients, children now, their ward or parents will bring them to the clinic. 2 years old, you start seeing massive tooth decay, rampant caries, all right? And you'll be wondering, where were the parents before this happened? All right? Now, what are the symptoms you need to look out for? I usually tell them, when you are brushing your children's mouth, look at it very well. When you start seeing dark spots on the teeth that were not there before, then it should be a cause for alarm. Take your child to the dentist or to the dental clinic. Let them be the one to tell you, okay, don't worry about this, or worry about this, or we need to do something for this particular case. All right, so when you start seeing for children, because they can't tell you, all right, until they start having pain. They may not be able to tell you, I have this, I have that, because you are the one taking care of them. All right, so look at their mouth when you are brushing their teeth. If you start noticing difference in color from what they used to be, of course, go and see the dentist. Not when they start having pain, because it will take some time from when the incipient caries. That's when the tooth decay starts. It will take some time from that time to when they start having pain. So if you present them to the clinic early, of course, there are other treatments that can be done, not just removing or tooth extraction. The tooth can be filled. There are other, treatments, conservative treatment that we can do for these children. So when you start noticing tooth decay, change in coloration of the teeth or a tooth in the mouth, just take the child to the dental clinic. Okay, now quickly, how many times in a day should one, brush the teeth? Well, usually we advise twice a day. All right. Basically, after eating in the morning and after eating at night, last thing before you go to bed. But what we do usually is once you wake up in the morning, you need to brush your teeth because you're not feeling the taste is usually it's funny once you wake up, all right? So, but it's better after eating. The reason is this, so that you don't have food residues or residuals in your mouth, all right? You just brush them out, the particles that are left, because those are actually the substrates that the bacteria, I talked about the 4 major factors. So those are the substrates that the bacteria will act on that cannot cause demineralization of the enamel of the tooth that causes the weakening of the tooth before holes start entering. So we always advise that you brush twice daily, morning and at night. All right, so what advice will you give to those persons that love making use of what we call toothpick? Okay, well, okay, let's talk a little about that. Usually, toothpicking, we don't advise it at all. We usually tell people if you're using the toothpick, the stick, we usually discourage it because it can lead to some periodontal diseases. All right, you can have come down with what we call pockets, and as you're doing it, you're creating hole in between. In fact, there's a bone, what we call the intertidal bone, that's supposed to be between two teeth. So while you're using that, you are destroying that bone, and of course you are creating more hole or more expanding space. The space, yes. And as you're doing it, when you're eating, food particles will keep on getting stuck there, and it becomes so difficult to remember before you start having pain. So we discourage that. Rather, we advise people to use what we call dental floss, the one that has that rope, the rope aspect of the tiny rope, the rope aspect of that to flux your interdental spaces so you can remove any food particles. All right. Definitely, we will say we have learned one or two about dental caries, tooth decay. So many persons, they want to wait till it has escalated. But today, our doctor has told us when you find you have some discomfort in your
gum, on your teeth, you need to go look for your dentist to tell you what you need to do. I think we're going to be having a part 2 of this discussion in order to broaden our knowledge concerning dental caries. So I'll be seeing you again next week for another exciting time. Do remember, health is wealth. Bye for now.